This is Vegas Inc. with Dana Gentry and Jeff Gillen.
An issue that is becoming a major concern to law enforcement and to parents alike. Abuse of prescription drugs like OxyContin and oxycodone has become a national epidemic. In fact, a recent survey found that among young people, prescription drugs are the second most abused category of drugs after marijuana. 70% of people abusing these pills have gotten them from friends or relatives. It's called drug diversion. Joining me now to talk about what can be done, a nationally recognized expert in drug diversion prevention, Robert Saenz. Mr. Saenz, welcome. Thank you for being on our program today. You know, as I was reading this material, I found this very interesting. Doctors are being held increasingly responsible. Now, in the old days, when I was going to a doctor, whatever, the doctor would give me a prescription, and then I'd walk out the door, and it's my business how I use the drugs.
That's correct. Unfortunately, physicians still feel that that applies. The federal government is looking at this differently. 28,000 people are estimated to have died last year because of prescription drug abuse. The DEA, the Centers for Medicare Services, and other federal regulatory authorities realize that it's a problem now, and the easiest place to address the problem is at the source. That isn't necessarily fair to all doctors. However, doctors can do their part by practicing due diligence.
And what would that be? I mean,
well, and that's why I've been here in Las Vegas. We spoke to a large group of physicians last night to discuss that. There are reasonable efforts, such as monitoring your patients. If you're going to prescribe them a Schedule II narcotic, such as OxyContin, as you mentioned, a painkiller, it's your responsibility as a physician to monitor them through urine drug testing when they come back for their refills, checking for aberrant behavior, to see if these patients are losing their pills or they're not showing up in their test.
You said urine drug testing, yes, to make sure that they are just taking, frankly, the required dosage and they're not showing up. They're not, wouldn't have gotten another drug or whatever and compounding it?
Correct. Or they're mixing it with other narcotics that could be dangerous to them. And the difference between these tests as opposed to labor testing is that you're looking for your narcotics, the drugs that you prescribed as a doctor. You're also ensuring that they're not seeing other doctors and perhaps inadvertently mixing these drugs that could lead to their death. There's other things. Nevada is one of 35 states that's fortunate to have a prescription monitoring program through the pharmacy board. And doctors, unfortunately, not all doctors use it. And they should. It is an opportunity for you as a doctor to see what other doctors are prescribing to your patients. Using those two tools and then having a drug agreement, an opioid agreement with your patient that says that they will not seek other doctors for these drugs or mix them with other drugs, establishes some due diligence on the part of a doctor.
Real quick, we've got about, I think, 35 seconds left, but is part of the problem doctors are simply overprescribing drugs?
That is part of the problem. The other part of the problem is society is looking for a quick fix. Right. And pain, often we look at pain as something we want to shut off. Pain is really an indicator that there's something wrong in your body and that you should do something about it. It's not just about taking a pill to shut it off. Perhaps physical therapy, massage, better diet. There's many other modalities you can talk to your doctor about it that can help other than just a pill to shut off the pain.
It's a huge problem. Mr. Saenz, appreciate your time today.
Thank you, Jeff.
Thanks for coming in.
Thank you.